Welcome back to Living East Tennessee. Well, this next segment is for you if you or someone you know may be one of those people who is at risk for a stroke. There's a brand new procedure that is now helping and making a life-changing difference to some of those patients. Afshin Skibba joining us from Premier Surgical. Thank you so much for being here.
Happy to be here.
And you're actually one of the first physicians to perform this procedure. It's called TCAR.
Yes.
Tell us about this.
Yes, so it's a new procedure that is intended to fix something called carotid stenosis. And what that is just narrowing in the carotid artery. And the reason why that's a problem is that if that narrowing gets tight enough, then someone's risk of stroke substantially increases. And so you want to fix it before someone has a stroke. That's the whole purpose, is to fix the narrowing before the stroke has occurred. And so there are a number of treatments that have been used in the past, but the nice thing about TCAR is that you can actually reverse the blood flow in the carotid artery. And when you do that, any kind of debris or material that breaks loose as a consequence of that all gets essentially suctioned backwards out of the carotid artery, as opposed to going up into the brain and causing a stroke, which is the very thing we're trying to prevent.
Absolutely, trying to avoid. Okay, who can benefit from TCAR? Obviously, a number of folks out there who may have these risk factors that run in their family.
Right. So, of the other available procedures, if anyone's eligible for the other types of procedures to fix a carotid stenosis, the vast majority are also eligible to have a TCAR procedure done. And so there are certain high-risk criteria that someone does have to meet in order to qualify, and just to sort out those details, you just need to be referred to your friendly neighborhood vascular surgeon to make that determination. Okay,
lots of folks out there likely watching have likely dealt with stroke within their family. There are a lot of traditional therapies out there. Who is this one best for? How do you differentiate, I guess, between the therapies?
That's a great question. So for a long time, the way that this was treated was with an incision in the neck. You'd open the neck, you'd open the artery, remove all the plaque trouble, and then fix it with the patch. That's called the carotid endarterectomy, and we still use that procedure commonly these days. But it is associated with a certain amount of nerve issue afterwards, because there are a lot of important nerves in that area, and a certain number of heart attacks also occur after that procedure. Afterwards came a new procedure called carotid stenting, where you'd access the blood vessel in the groin or the blood vessel in the arm, and you would open up the carotid artery using a stent. But the problem is that even over the years, as we have evolved to have these nice baskets and things to try to prevent that debris from going north, still the risk of stroke from that procedure is much higher than with the standard surgery that I mentioned a minute ago. So now along comes TCAR, and TCAR is great because it's the best of both worlds. You get the low risk of having any kind of nerve trouble or heart trouble that you would normally see with surgery, with the low risk of stroke, all combined into one neat little package. And the best part about it is that it has a risk of stroke that is in fact a little bit less than either of those two. And it's just not very often that something comes along that is not only equivalent to standard therapy, but in fact improves upon it.
Right, and takes that risk down for the patient, which is critical. Okay, we've talked about this before. Lots of family members likely looking at their family tree to see those risk factors. But what are the risk factors for someone for stroke?
So smoking is one of the biggest risk factors. Diabetes, trouble controlling blood pressure, and of course issues with cholesterol. They're all additive that can increase the risk of having that type of narrowing there in the carotid artery.
Okay, so important things to keep in mind, and just a miracle procedure, it sounds like, as far as reversing
some of those things.
It's a great innovation.
It's a great innovation. We're very excited about TCAR.
Awesome. For more information, where's the best place to find you guys?
So we're at 6408 Paper Mill Drive, right next to the Holiday Inn Express.
Okay, and we will have that information available for you on our website as well. Thank you so much for being here. We appreciate all of the information. Coming